everyone. Pregnancy and what are the things you need to look for as far as basal temperature and other things? Well, we are going to talk to an infertility specialist who studied Chinese medicine at the Pacific College of Oriental Design. We are going to be talking with Anga Gonzalez, who has helped hundreds of parents conceive, have a safe pregnancy, and have healthy babies after delivery. I am Amita from Nourish Talk, a global platform for natural and holistic therapies. I'd like to introduce all of you to Anga Gonzalez, who's joining us live from Barcelona right now. Welcome, Anga.
Thank you for having me.
Great. So let's get started on what is it and that women have to look for.
Yeah, I do really start with the basics with my patients and everybody that comes and sees me either online or one-on-one, and that is the menstrual flow. The menstrual flow and the color of the menstrual flow is really important. It tells a lot about the health of your uterus and your lining. So that's like a very basic information that we need to have to be able to then go from the lining and the uterus into a good ovulation, good, what I would call like a flow, like a menstrual flow into the ovulation, and then progesterone luteal phase and implantation and pregnancy. So here in this slide, we can see the different colors of what your flow could look like. And in Chinese medicine school, we always learn the different colors to mean different patterns or different signs or symptoms that the patient may have. We can maybe start with the dark eggplant purple, heavy bleeding. This could actually be not as such a good sign. Sometimes some women have 2 days, some others are 6, 7, 8 days. Normally, those could be the first days of the cycle. And when it's dark and it's heavy, we normally think that there's maybe an accumulation of estrogen, maybe signs of that could also be considered a sign of PMS. And then also there will be a polycystic PCOS or endometriosis and cysts even. So when this happens, and the patient comes to us in those first days of the cycle, we normally move the blood, make sure that the blood is enriched with oxygen. And so pretty much our treatment is geared up to move, generate new flesh, new blood, so that when the woman has, the window for fertility, right at ovulation, this enriched blood will be already taking part on what it is the uterus, which this is pretty much the bed where the cell, and the form already ovocyte will actually land on. Then there are some other ladies that would have maybe a light bleeding, which may indicate a very low estrogen. That would not be good, because that means that your FSH is not giving a strong enough message from your pituitary gland. And so we need maybe to then look at different ways of getting that blood stronger. Here, we don't want to so much we want to nourish, but we're not so concerned about a lack of oxygen here, but more so that maybe there's a deficiency in iron levels here. So we'll do a lot with Chinese herbal formula or something like that, or even nutrition for iron-rich foods and stuff. A bright cranberry red normally is a very, very healthy period. Normally we want to see something like that. Sort of would be like maybe I'm thinking about different fruits, maybe that would be like a blueberry, not blueberry, like a raspberry color could be.
Or a cherry? You think a cherry color too? A cherry or a raspberry?
Yeah, maybe a little bit less than a cherry. Yeah, because a cherry could be a little bit darker red, right? Than that. Yeah, between a cranberry and a cherry, not a too dark cherry. And then, here, that would be something that I would like to see maybe from the beginning almost to the end maybe the last drops could be a little bit darker. I think that happens to everybody. But if you start, a very dark period, it could be that you didn't clean up, from the previous one, and we don't want to grow an endometrial lining on top of an old one. We want a clean, fresh one. Um, and so mainly all of those 3-4 days of bleeding should have a color like this, and we're always looking at not having the when you have little pieces, I forget now the English word for that, but maybe little bits and pieces that are like in the blood itself that are darker color many times. We don't want that either. That shows that maybe the liver is not clean and things are not working in the blood, when on your cervix and your endometrial tissue. Then some women also, the first color, as I said, of the could be a brownish maroon, which very often means very old blood from the previous cycle. And then vaginal infection is more of a yellowish to a greenish. We don't want that either. So this would be all the options. Some women can also have a different version of this, but that so our treatment will always be geared to depending on where the flow is like and what the woman would need, depending on that, if we want to tonify or we want to move.
Okay.
Yeah, so maybe we can move on to the next one. So that would be the first thing I look, is the health of your menstrual cycle, your bleeding especially. But then we go to in my program I have 5 founding pillars where I go into looking at the hormones, looking at see the ovarian reserve, if there is any persistent condition or any diagnosis that you're already getting, if maybe you're not ovulating on time, maybe you're just trying to get pregnant for 2 to 3 years and you keep miscarrying, all of this, even if you're in IVF treatment as well. So we look at the pillars as being, dietary, herbal, mind and well-being. Then there's the treatment per se is another pillar, and then how we put all that together, for the patient. So if this is you, your hormones are all over the place, my eggs are running out, or they're in bad, they're not the quality, they're telling me they're not the quality. All of this can be looked at under the Chinese medicine horoscope. There's a lot of studies that show now that maybe the quantity of the eggs maybe is harder, but the quality of them is very easy to better. Also, as well as ovulating, sometimes polycystic ovarian syndrome, that you don't get up to ovulate on time. You don't know if you're ovulating at all, even anovulation patients that come over, and then the miscarrying as well. Miscarrying very often happens when there's not a good or there's not enough time, there's not enough progesterone in the body to have a good implantation, or when the implantation happens, but there's maybe some blood factors that keep making you having to miscarry, because the blood in the sac, around the sac, is not how it should, and then the body is more prone to expel out everything that's in the containment in the uterus lining. Okay. Next one, maybe we can go into. Then we have a very basic blood test. A lot of the times, some of my patients, they come to me and they say, well, I've been trying for a year or two, but I haven't done any of the tests. Some other patients have all the tests and they've been doing tests for a long time. So sometimes it's just it's really one of my the funding pillars I was talking about is really going into like what's really happening, like the core, the seed, what's really going on with the patient. So I always have them checked. Besides all the infections and sexually transmitted problems that could occur, thyroid health is very important. A lot of women, like up to 60%, could have miscarriages out of the thyroid that's not really working well. I look a lot into adrenal and thyroid are really well connected, and the nutrient level, and also how you're lining in your stomach. That I apply functional medicine for that, just to look at how your gut is really absorbing. That's very important. That also very important with the thyroid and the adrenal. Pretty much all of it is just working unison. Then the antral follicle count is when you go in and they do a test, to count on the follicles that are actually inside. Normally a few of them you have, and then there's one that's the alpha one that stays, especially if it has been um, uh, with the sperm. It has been, like how you say that, like um, just if the sperm finds this follicle, and they actually get together, and it kind of creates an egg, and an accountable egg. So besides the blood test and the antrical follicle count, the fallopian tube health is very important, where some women maybe structurally have a tube that's not really permeable or stuck, or maybe they had a fever. They had a fever when we're young, or maybe even a sexually transmitted disease, and then they have to go in there and look. It's a little bit more invasive, but sometimes if the hormonal are really going well, the follicle count is good, and the FSH and the LH, testosterone and progesterone, they're all at good levels. Sometimes we go into, a little bit more of information about how the tubes are, the health of the tubes are there. So we go from hormonal, like the period, making sure that. Then later on, I'm going to mention the BBT chart to see how the hormones are going from one into the next. Then we go into these counts and blood tests, and then finally we go into the structure part of your reproductive system, and then on top of all that, we are not going to mention that in this one, we'll also look at genetic and immunology and blood factors as well, to make sure that we have a big picture of this person and we know what's going on. So maybe we can go to the next one, Amita. Thank you.
Yeah, you mentioned about the genetic testing and blood
Yeah.
clotting. Yeah.
Yeah.
Okay. Any other test here for fibroids and PCOS or anything?
Yeah, this is other ones that maybe they're actually harming the implantation, and a healthy baby would be looking at this. These are also a lot of the immune system, polycystic ovarian system, and the syndrome, and the endometriosis as well, fibroids, and polyps very often come as a problem with estrogens and estrogen, too much of it in the body, like just an overflow of estrogen in the body. So I put patients on dietary and supplementation to get rid, and sometimes even just with a little bit of a cleansing of the liver, which is the organ that has a lot to do with a lot of these hormones and how they all come and flow up and down in the body. So I look into cleansing and detoxifying before. I'm making sure that I look also into into what they're doing at home, what they're putting in their bodies. A lot of these phenoestrogens are in our home environment, and very often we take some of them out, and the body actually reacts really, really well, and you get rid of this excess estrogen in the body. And I've seen fibroids and polyps go down in size doing that.
All right, so let's yeah, let's talk about the body basal temperature. I think a lot of women want to understand this.
Yeah, yeah, this is something I always do. A lot of the doctors now, maybe they don't have, your gynecologist, they don't have time to go through with you on what it means to take your temperature and how you should do it. But I do advise to do that to the patients that come to me, because it's a real picture of what's going on with the fluctuation of your hormones in the body. How the resting temperature increases depending on where you are, in the body. And here, the 2/10 of a degree centigrade, or a degree 4/10 of a degree Fahrenheit. When you go from an ovulation into more of a progesterone luteal phase. So there's the follicular to the luteal. Normally it's a biphasic curve. And also there are a lot of apps where you can actually take that, and they will take that for you. But I normally do give it in paper form, because some of the patients can actually put, I had a headache, or I did feel run down, maybe, and very often I control that they're not picking low sugars or high sugars, for the adrenals. The body needs to be as its best, like no inflammation. It's like having a very important, having a very clear schedule. It's like being a baby again. Like when you eat, you go to bed 8 hours to 9 hours, making sure you're hydrated, make sure you're rested, that you're eating every 2 to 3 hours, so your blood sugars are where they need to be at. Eating depending on your cycle, where you are on your biphasic. If you find out that you're doing it right, what's going on, maybe is there a particular supplement that we need to supplement, because maybe you're not eating at home, or how we can actually help you, to get more of this um, um, food or supplement that you're not getting, um, and making sure that it all looks good. It all looks good, plus all the things that you can do at home. Yeah, here's the picture of what happens when you go, this lower BBT here. Actually, I would like, after the fourth day of the cycle, you can see the woman, like, it drops here on day 2 to day 3. It drops. This is normal, because your estrogen and progesterone levels drop, and this is what means to lose your and this is what comes into your period, is that blood, that this taking down of the walls of this lining. And then it drops down. But then I like to see it maybe right at 97.4 or 5, and stay around that. And here we see a little bit of a sawtooth like temperature up and down, and that's not what I would really like. That red line there should be a little bit higher than that, between 97.5 and 97.4. And a good one would be one that would stay really nice without doing the ups and downs, So that, in Chinese medicine, we say this is the heart and liver qi. When there's fire, when there's stagnant, and maybe there's about you and your relationships, your relationship with yourself. Maybe you're just worrying a lot, and this is where estrogen comes up, and this is when most women worry a lot. So this is the yin side of the part of the both. This is the yin before, the follicular, and this is when we do a lot of this blood regulation. So calm your mind, making sure your heart, your liver are in a good state, like calm. And then the kidney underneath, we just get the wave. It's like a wave, like the Japanese painting, as you, I don't know if you've seen it. It has sort of a wave of water, and picking up that water is what's going to keep it then up high enough so that you can keep a good endometrial lining, and then an ovulation, between the follicular and the luteal phase. because we need an increase of temperature and keeping it at least for 12 to 14 days so that the implantation can occur and the egg can grow.
So I think that's all we have for today. Is how to really take care of the basics, right? The how's your menstrual flow, and how's your BBT. So anything else you want to add for today's session? And we'll be bringing other sessions like small 15-20 minute sessions with Anga in future. Anything else you'd like to add before we close down this session today?
Well, just add maybe a little bit about these are the basics. Most women should have signs and symptoms that will get released just with just getting this in order. Sometimes we have PMS and we think it's normal, like a very heavy flow, and we feel down or irritable, or we feel that the energy really drops, and that shouldn't be the way. That's not what's normal. And so by bringing the woman to a normality, then we can from there make sure that she has all the resources to pull from, so that because when you want to form a new life, then you need to have resources, you need to have extra. So yeah, I just wanted to add that.
Thank you so much. And then what we will do is we'll be bringing other topics, and I would be talking about nutrition, right, and supplements, and some of the other things a pregnant woman can do while trying to, before the pregnancy, during the pregnancy, and of course postnatal as well. With that, we'd like to end this session. If people are willing to, ask questions or give us comments, and reach us about how you like the session and what you like to see in future. With that, thank you so much, Anga, for being with us. I know it's
Thank
late
you,
in
Mika.
Barcelona. Thank you so much.
Thank you.
Bye-bye.
Bye bye.